Hi everyone, good evening. Just adjusting the camera over here. Okay, should be okay. Just 1 second. Hi everyone, good evening, and welcome to rumpalsurgery.com on Instagram. Thank you so much for joining us. So today we're just gonna wait for everyone to come on, and we'll be talking a little bit about the Malaysian Medical Association's efforts during the COVID-19. I have a distinguished and good friend of mine, Dr. Saravanan, and he will be joining us very soon. So we're just gonna wait a few moments for everyone to get on. Yeah. Hi, Dr. Sarah.
Hi, Sanjeev. Can you hear me?
Hi. Yes, I can. Good evening.
Yeah, okay.
Yes, thank you so much for joining us today. We're just
Thank you
gonna
for the invitation.
we're just gonna have to wait a little while to let everyone log on. Yeah.
Okay.
It will start in around exactly 5 minutes from now.
Sure.
Yeah. So
Can.
just to start it off, I'd like to welcome everyone for joining us on www.rumpalsurgery.com, and this is our Instagram part where we invite people from a healthcare sector in Malaysia, orthopedics and non-orthopedics in general, and we talk about healthcare matters, and we'd like to engage in public information on medical information for better patient education and also better patient decision making. Today, we're just going to wait for everyone to come in, and then we're going to start. Dr. Sarah, thank you so much for joining us. Yeah,
My pleasure. Thank you.
Yeah, so we have Dr. Erata joining us from MMA Wilayah. Welcome. And we're going to have a few people come join in. So we're just going to wait for 2 to 3 minutes. Yeah.
Sure.
So, Dr. Sarah, you're logging in from your workplace or from MMA itself?
I'm really at home now. Yeah, left work early today.
Ah, nice.
Yeah.
So we're just going to wait for another few minutes, and then we're going to start. Okay, then while waiting for them, maybe you can introduce yourself. I'll probably introduce myself. I'm Dr. Sanjeev Rampal. I'm the host here on Rampal Surgery at Instagram. And today we have a good friend of mine who's been practicing medicine for the last 20 years. And he's a general practitioner and also a leader in the local doctor community in Malaysia and also in Wilayah Persekutuan. He's also the chairman of Malaysia Medical Association, currently the current chairman of Malaysia Medical Association, the Wilayah branch. And he's a very distinguished member of our team, and we would like to welcome him to our Instagram session. And I thought it would be a nice way to get to tell people about the efforts of Malaysia Medical Association and what they've been doing. As we all know, Malaysia Medical Association is the oldest and the biggest association of medical professional doctors who have been licensed and also who are board certified to practice in Malaysia. We have the largest amount of medical personnel who's been registered as membership, and Malaysian Medical Association, or what we'll be using the short form of Malaysian Medical MMA, Malaysian Medical Association. Well, they have a lot of activities, and is basically a professional body, a NGO that pushes the agenda of doctors and giving priorities to doctors and their welfare and how they engage with the community and also with other stakeholders in the Malaysian healthcare system. Hi, Dr. Kiran, welcome. So we'll be starting very soon with my distinguished guest, Dr. Saravanan, who's the chairman of Malaysian Medical Association Wilayah branch. Maybe Dr. Sarah, while waiting for them, you can give them a little bit of a background about yourself and
Sure.
what you do. Yeah.
Thank you very much for the kind introduction, Dr. Sanjeev. It's good to be here in this program today. As Dr. Sanjeev mentioned, I'm Dr. Saravanan. I'm a GP, running a clinic in KL, Kuala Lumpur, and I'm now currently the chairman of MMA Wilayah for the 2020-2021 term, which is coming to an end soon. But thankfully, during the last AGM, I was voted to be the chairman for the 2021-2022 term as well. So, as such, I'm glad to lead my MMA Wilayah team over the last 1 year and heading on to the second term. So yeah, basically I'm a GP. I graduated from KMC Mangalore under the Manipal Academy of Higher Education, MAHE, and I've been around for the last 20 years or so in practice in Malaysia. Yeah.
Congratulations on your election as returning chairman for the year, and
Yes.
hope that you continue to do good work for Wilayah MMA. Yeah, so today we're going to start. We got a few people joining in, and thank you so much for joining in. And we're just going to start it off. So today, Dr. Sarah Dr. Sarah is also, if you guys are joining, is the chairman of Malaysian Medical Association. It's the biggest and the largest association of medical professional doctors who have licensed or board certified to practice in Malaysia. And the Wilayah branch also constitutes Wilayah Persekutuan, that's Kuala Lumpur, and also Putrajaya. Yeah, so Dr. Sarah is a representative and he's the chairman of the association for this year. And he'll be joining me today, and we'll be talking about what is MMA, the Malaysian Medical Association short form, MMA, doing regarding what are the efforts they are doing during the pandemic of COVID-19. Yeah, Dr. Sarah, so would you like to brief us through about, first of all, MMA Wilayah and your team, and also what you guys have been up to and what you all been doing for the COVID-19 pandemic?
Okay, sure. Thank you once again, Dr. Sanjeev. So MMA Wilayah Persekutuan is one of the state branches of the Malaysian Medical Association, and we represent the members of Wilayah Persekutuan Kuala Lumpur and also Putrajaya. Okay. Even though we have another Wilayah Persekutuan that is in Labuan, but they come under the MMA Sabah branch. Yeah. So currently we have almost about 2,000 members under the MMA Wilayah. So we are the second largest after MMA Selangor. But I'm happy to say we are one of the, or if not the most active branch in the country among all the other branches, probably because we are in the capital, and and we have the support of our members and also other non-members as well and well-wishers. So we just had our 37th AGM in July, beginning of July. So we have been in existence since the last 37 years. MMA has been in existence for the last 61 or 62 years, but we are in existence since the last 37 years, I suppose, after Federal Territory was formed and after they broke off from Selangor, and then a branch, Wilayah Persekutuan, was created. Yeah. So that is the brief introduction of MMA Wilayah Persekutuan. So shall I move on what we've been doing over the last one term, especially with the COVID in the country?
Yeah, that'd be great.
Yeah. So basically, as everyone knows, last year, March, the country underwent the first MCO when COVID was really beginning to hit the country. Okay, so when our former Prime Minister Tan Sri Muhyiddin Yassin announced the first MCO, everything came to a standstill. I don't think any one of us would have experienced this type of standstill in our lives as long as we remember. Okay, so even the doctors, okay, especially the private practice GPs, we also were affected, because we hardly saw any patients. There were, almost zero patients. Some clinics a lot of clinics, had closed down or were on the verge of closing down. But thankfully, MMA, that's MMA HQ, spoke to the ministry and suggested, why don't we allow the GPs to also get into the swab test, for the RT-PCR and RTK antigen. I mean, first was the RT-PCR, instead of burdening the frontliners in the government sector, So the one of the conditions by MOH was the GPs needed to undergo training and get a certificate before they are qualified to do the RT-PCR nasal swab test at their respective clinics or at work sites, in factories or in shop lots or wherever, industrial places. So being proactive, our MMA Wilayah under our PPS chairman, Dr. Radha Krishnan, I think, who's also here today in this program, spoke to the JKWP, Jabatan Kesihatan Wilayah Persekutuan representatives, I think Dr. Mimi, who's in charge of CCAPS, and organized this training session, okay, for all the GPs to join, So we started in May, just within a month or month and a half after the MCO was announced. And subsequently, many more training sessions were conducted in collaboration with even BKKP. I think that stands for, Bahagian Pembangunan Kesihatan Keluarga, and JKWP. And most of the training sessions finally were conducted at Hotel Armada. And it was not only limited to the GPs from Wilayah Persekutuan Kuala Lumpur, also GPs from Selangor and other nearby states like Negeri and Melaka also joined in. So eventually, I think there were more than 500 GPs who were trained till last year, December 2020. Okay, so those were the initiatives that was conducted by MMA Wilayah, thanks to our hardworking and dedicated PPS chairman, Dr. Irada, and also with our national PPS vice chairman, Dr. Bala Chandran, who's also in our MMA Wilayah committee. So that was what we did for the GPs to make sure it's a win-win situation, to lessen the burden for the government doctors, and also to have some income for the GPs, so they don't have to shut down.
So, Dr. Sarah, around how many doctors were trained? Around how many doctors?
More than 500.
More than 500.
500 GPs, yes, were trained under the MMA Wilayah initiative. But of course, throughout the country, there were other states who also had done this training program. But under Wilayah, we had more than 500. We got 500 over GPs trained for this certification for the nasal swab. Yes. Okay.
Wow.
So, and then they got on board and started the program. Started doing it with their respective.
So, Dr. Sar, if we ask, was it smooth sailing? Was it easy to set up and to organize this such a big
initially because some were keen, some were not keen, and who can join? Because some of the GPs, they were requesting whether their staffs, whether their clinic assistants can be sent for the training, but it was meant strictly only for the doctors.
It's great.
Yeah, initially there were some teething problems, and where we could have the training whether, you know, JKWP, the place was small, so eventually we needed to get Armada Hotel. We identified Armada Hotel because of the location. It's a border with Selangor and KL, PJ and KL. And also it was feasible, and they gave us a good price, you know, because a lot of factors, you know, the pricing also needs to be right, you know. At this point of time, we can't afford. Yeah.
So
So
Dr. Saravanan,
actually, it
that
was a
was for
success.
the
Yeah. Even after we finished the last batch of doctors in December, there were more demands, but then we couldn't entertain because there were other, the vaccination had already started to roll on. So we started concentrating on the vaccination.
So that was for our doctors. What
Yes.
the efforts do you guys did also for the general public? Yeah.
Yes.
We as
Okay.
a NGO was
just 2 months
contributing to
in
them.
June, somewhere in June.
Yeah.
Yeah. MMA Wilayah in June, we decided when the MCO 3 or the full MCO, FMCO took place, we realized many of the public, of the rakyat, were out of job and out of income. They were, you know, they were just hand to mouth, or just, you know, on a daily basis of food. I mean, they were desperate for food. Yeah. So even way before the Bendera Putih campaign started, MMA Wilayah initiated this food basket program. Okay, that was in the first week of June, and then subsequently we identified Brickfields Asia College, okay, who were doing this food basket program as well. So we tied up with BAC and conducted this food basket program for a period of weeks. That's from June 21st to August 22nd. We just ended. And I'm happy to say we managed to supply throughout the Klang Valley, 400 families, and each family, if a family of 5, the food basket will be sufficient for 2 weeks. It was all dry items, dry ration, okay? So cooking oil, rice, 5 kgs of rice, onions, potatoes, mihun, milk powder, flour, sugar. So the basic dry items which could last a family of 5 for about 2 weeks. So 400 families, and our target recipients of this food basket were the B40 from PPR flats, the migrant workers who are out of job because, you know, construction and many other sectors were shut down, the refugees, and and also the OKUs. Yeah, these were our target recipients. Recipients or beneficiaries of this food basket. So that was for the general public. And of course, we just recently, last Friday, not even a week, we started a donation drive, and we managed to raise some funds and donated a high flow nasal cannula oxygen apparatus to Hospital Selayang. You know, so this apparatus is really beneficial.
That was lately. It was like last month.
Yes. Just the last week, actually. Last week.
Okay.
Yes,
so what exactly was given?
The high flow nasal cannula oxygen apparatus, which will help, will prevent people from being intubated, you know. So it can save lives, you know, because as we know, sometimes once a patient with category 5 COVID-19 is intubated, it's 50-50 whether he or she will survive, or he or she will come out of it. So this high flow nasal cannula, or HFNC, is supposed to prevent, is a high chances of preventing the patient from being intubated due to the oxygen concentration that is provided by this apparatus.
Wow.
Yes.
And all of it was done by
So that is
donations
the
or
role of
by
MMA Wilayah for the public.
yeah. But was that
Yeah,
contributed by NGOs?
donations and yeah, mostly by individuals, and from our MMA Wilayah itself, and also the MMA Foundation. So
Okay. Particularly
doctors,
from
friends,
MMA.
and well, yeah, across the
Well,
board. Yeah.
okay. Is there a place where if the people or the public, general public, want to donate to MMA, is there a place to do it?
Well, we can provide you the account number. Perhaps can I share with you later in another
Yeah,
later
yeah.
because
Yeah, so Dr.
yeah.
Sarah, so that was a splendid explanation of the efforts. Is there anything in the future that we can expect from MMA as a whole during the COVID pandemic? Are you all continuing your cooperation with the government and with the vaccinations and all the other efforts?
Yes, but as a branch, we don't really have the say to negotiate with the government. But our HQ under the President Prof. Dato Professor Dr. Subramaniam and also the HGS Dr. Arasu, they are having continuous discussions and engagements with MOH, on how the government and the private and public sector and the GPs, everyone can work hand in hand to overcome this pandemic as soon as possible. And we hope with the appointment of our new health minister, Mr. Khairi Jamaluddin, KJ, things can move forward even better. We believe he's a person who will listen and engage with MMA and will implement certain things that we might advise him to do so. Yeah, we
Fantastic.
hope so. Yeah.
Yeah. So that means good times ahead. Then we hope for that.
So. Fingers crossed.
Yeah. Sarah, would you like to summarize our take-home message to the general public about our efforts, MMA Wilayah's efforts
to the
during
general
the
public,
pandemic?
right?
Yep, to general public.
Yeah. Okay. I mean, the Malaysian Medical Association, as Dr. Sanjeev had mentioned earlier, is the largest doctors organization in the country. We have members who are doctors across all divisions, public, private, in the academy, and and all we represent doctors from Perlis till Sabah. Okay, and every state has got their branches, and we not only we represent the doctors, we also take issues that are being faced by the public, especially on health matters, and you can feel free to approach any of your state branches in Wilayah. You can approach MMA Wilayah. Perhaps I can give you the website after this. What's our website? And you can drop us an email, or you can also follow us on Facebook, and leave your comments, and God willing, if we are able to help in whatever way, we will try and do our best to help you all. Okay, but you must remember, we are a private organization. We are not a government organization. So a lot of things will also depend on the government, and we'll try to work our best with the government to help the public out there.
Yep.
Thank you.
Dr. Sarah, thank you so much for joining us. Dr. Sarah is also our Malaysian Medical Association Wilayah Branch Chairman, and he's a distinguished member of our doctor fraternity. We'd like to thank you for joining us and explaining this to us about the MMA efforts during the pandemic. We hope to have you back again. Maybe we can talk about a little bit more about healthcare matters in the near future, probably before the year end. Yeah, I'd like to thank you again, Dr. Sarah. I'd like to thank everyone for joining us today. And the video will be up on also on Facebook and also on YouTube. by the end of the day. I'd like to thank everyone, and I will see you all soon, probably next week. And we'll be talking about knee pain and also about head injuries during football matches. Yeah, I'd like to thank you all. Bye-bye. See you all. And until then,
Thank
you
you.
can also
Bye-bye.
follow us with Instagram, Facebook, and YouTube. Bye-bye. Thank you.
Thank you.
Bye-bye.